All right, we're doing the actual Pap tray today. So I'm gonna go ahead and explain exactly what's actually on the Pap tray. We have 2 pairs of gloves. One glove is for the physician and one's for the MA. The gloves right here you see may be the same size, but it may not always be that way in the field, okay? You have 2 different sizes of speculums. One can be reusable after it's been sterilized. One is a disposable, okay? KY jelly, you have an antiseptic wipe, so they could go ahead and the young lady go ahead and wipe for any discharge after the procedure, and a panty liner. This may or may not be given at every facility, just depending in regards to what facility you guys wind up working at. To the right, you see a swab. This particular swab is used to go ahead and run any cultures that may be needed, such as for STD, gonorrhea, and chlamydia, just to go ahead and name a few. On the very top, this is old school method of Pap. This is your fixative, your spray, and this is your slide. This is considered a conventional method. You have your spatula and your brush. If you zoom in, you're able to go ahead and see on the slide there's a V, a C, and an E. The V in the spatula is for the vaginal wall. The C is like represents C for the cervical wall. And then the brush is for endocervical, within the cervix. So once the actual physician has already collected specimen, your job as future MAs is to actually smear whatever specimen according to what it is, if it's V, C, or E. Once the specimen has been smeared on the actual slide, it is your responsibility to spray fixative. We're playing make-believe, so you're gonna go psh, psh. That's it. And of course, you close it, you snap it off, you label it, you send it out to the lab with the requisition form. We're gonna go ahead and do step by step. Ms. Brenda will be my MA. I will play the role of the doctor. My patient, as you can see, her name is Sally. I'm gonna go ahead and turn on the light for the full effect. Patient will be in lithotomy position. Lithotomy, also known as the missionary style. In this particular case, my mannequin, I cannot put her all the way to the very end because the stirrups won't hold her. These are stirrups. Let's hold the legs. So the actual pelvic region will usually come to the very end of the actual bed. Okay, in this circumstances, my mannequin doesn't suit it well. So, okay, Sally, how you doing? All right. My MA will give me my gloves. While I am gloving, the MA will also be gloving as well. It's been a long time, Miss Sally, a full year. Hope everything is okay. You're gonna feel my hands. Some doctors are rough, some doctors are gentle. It just really depends, okay? All right, so some speculums will be on the Mayo stand, which is right here. There's a vaginal speculum. The actual name of the speculum is Graves vaginal speculum. The actual instruments are named after their maker. Some speculums are sometimes down here. Under circumstances, there's nothing. There would be an actual heating pad in the speculums here because they want to make sure that the speculums are nice and warm before they're actually introduced into the vagina, okay? So in this case, we're gonna do regular size. When you hand it to me, you're gonna hand it to me as I could grab it. So you're gonna grab the deck, it's sterile. So you can grab the set, and I'm gonna grab it, okay? My actual speculum. Sally, you're gonna feel some pressure. The speculum is gonna go inside the vagina. You're gonna go ahead and open up the speculum. You're gonna use this little rod right here to go ahead and tighten it. For those that have natural long pubic hair, this is what pulls on their hair, right here. This little knot right here, okay? Now that the speculum is open, I can actually see the what? Cervix. Believe it or not, just so that you guys are aware, a young lady that is pregnant, her cervix will be blue because of viscosities. It's pretty interesting, okay? The doctor will extend. Very first thing is a spatula. You have to hand it to the doctor according to the actual way they're gonna be using. So it's gonna be the actual part down, the spatula down. The very first start I'm gonna scrape is what? The vaginal wall, okay? I'm gonna turn the spatula around, and what am I gonna scrape now?
The cervix.
The cervix. I'm gonna go ahead and give this off to my MA. She or he will be scrape the actual specimen onto the slide. Meanwhile, he or she will send me my brush, and this is for the what? Endocervical, within the cervix, so a little bit further in, scraping it. I'm gonna give this pass to my MA. All right, Sally, we're almost done, sweetheart. We're gonna run some other tests on you, and then we're gonna run some cultures. I'm just gonna go ahead, and pop it, just hold it, grab it, and I'm gonna go ahead and collect the specimen. There's some discharge going on. I'll hand this off to my MA. All right, Miss Sally, you wanna go ahead and remove it. You're gonna feel some release of pressure. Some doctors will throw their instruments, no lie. Doctor will stand, KY jelly is placed on the fingers, 2 digits. The fingers will be introduced inside the vagina. The doctor with the other hand will press down on the pelvic region for feeling for any lumps or masses. Sometimes they can feel it, sometimes the doctor, he or she will actually tell him or her if they feel any discomfort. All right, Sally, everything looks good. Now go ahead and scoop back, which is, you know, she will scoop back, and then we'll go ahead and call you with your results. And then by then, of course, you know, you're going to be labeling your stuff, and then you're going to go ahead and give the patient what?
I'm going to give her a wipe and a liner in case I need discharge and if she needs to wipe.
Okay. And remember, discharge can be the fluid
Or blood.
from the KY jelly, and or sometimes the actual speculum can irritate the lining, and some young ladies do spot. Because remember, the speculums come in different sizes. Remember, if a young lady's on birth control for at least a year, they have to automatically start getting a well exam, even if they have no sex, but they've been on birth control for a year. So that's why sometimes when they go for a well exam, it may bother them more because they've never had any type of penetration.